We're out to find out from people what their reaction would be if they came in contact with Ebola survivors or met with someone who had been in contact with an infected person.
If I meet any of them that have it before, well, I might not be too close to them because they fear that the thing might not even go totally. Might be in me that I might be fear that the thing may still reappear.
I won't touch, but I will pay a visit. And I will ask them questions, how they go about it, their medical reports, and also I will keep encouraging them to keep going back to check themselves.
If I can have a certified result, like showing that the virus is no longer with you, then yeah, I will relate with you.
Since the person did not have again, no problem. So, yes.
You eat with the person? Eh? You're not sure? Say something.
I don't know what to say.
Stella invited us to her home. She lost her husband of 27 years to Ebola when the disease hit the shores of Nigeria. The late Dr. Amos Chukwuwamju Obaniwo was the Director Clinical Service at First Consultant Hospital, Obalende. Stella says she and her children were stigmatized and are still dealing with that.
Unfortunately for us, doctors were on strike when my husband was down, when he was ill. So we couldn't use the general hospital, all the private hospitals we went to. So they couldn't allow him into their hospital. Eventually when he died, me, the wife, and my children faced a lot of stigmatization. The environment where we lived, they were running away from us because then the thing was fresh.
Sure.
The family downstairs, in fact, relations, friends, they were scared.
Habiba had a similar bitter experience with stigma. She is the wife of the protocol officer that received Patrick Sawyer at the airport when the Liberian American flew in from Liberia with the disease. She was 6 months pregnant at the time.
People will not come close to you. Your child can no longer go to school. I was even asked, at a point I was asked not to come to school because I also was running my second degree at that moment. Okay. So I was asked not to come and all that, but it later stopped.
We also met with Bankole, the only child of late Dr. Ameyo Stella Adadevo. It was her courage and expertise to have quickly identified and contained the first case of Ebola virus in Nigeria that spared the country what could have been a catastrophe. Bankole and his father were among those medically monitored for 21 days, the maximum incubation period of the Ebola virus. The 26-year-old says his mother's dedication to public safety prompted the risk she took at the expense of her life.
I remember when this guy came in and she was traumatized. All I remember telling me is that, look, this guy is severely ill. I was praying for him. This is someone that came and infected her and infected other people. She was praying for him. She was a very spiritual person. She was, a doctor is there to prescribe medicine and stuff like that, but she always went above and beyond, giving people home calls, going to visit them, wherever they are, to make sure that they were actually taking their medicines, getting better. So for my family and me, what is important is that, look, the Nigerian healthcare system is not where it should be.
This general physician is one of the doctors who contracted the Ebola virus but survived it. Dr. Akiniyi is still in shock as to how he got infected because he says he didn't touch the patient but entered the room in which the index case was receiving treatment.
That just shows you the level of how fast Ebola can be transmitted from one person to the other, as long as the closeness is there. So you don't have to touch the person really, because I didn't touch him. And I entered the room. I was just a few meters away from him, and I came down with it about 8 days later.
He had his own share of stigma even from his colleagues, and that almost cost the life of his wife.
Yes, after being discharged from the isolation center in Yaba, I remember my wife, she was having some symptoms of depression. So we decided to go to one hospital that I left just before I was taken to isolation. So they were aware of my status. then. So when we got there, they saw me, and stigmatization was the order of the day. They didn't attend to us.
The Lagos state government recently gave each of the 13 survivors and affected families 2 million naira each and 50 million naira to First Consultant Hospital. But they are disappointed that the federal government has not reached out to them.
I expect the federal government to, remember that he left a wife and children behind to support us, most especially the First Lady of the Federal Republic of Nigeria. She's a woman. She knows how it feels to lose one's husband. It's not easy.
We want direct communication from the federal government. We want them to say, okay, how are you guys feeling? What have you passed through? How can we help you? Things like that should be coming from the federal government, because they own the whole country and they can even help us better than what Lagos State can do for us.
Nigeria had 20 confirmed cases of Ebola and eventually 8 died, a number that is minimal compared to thousands of lives being lost in badly hit countries of Guinea, Liberia and Sierra Leone. Vivienne, Irikefe, TVC News, Lagos.